Hi, everybody. My name is Adib Khan. I am with Delta Dental of Colorado, and I am here with Deidre Johnson, who represents the Center for African American Health as their CEO. And she's going to talk to us a little bit today about their organization, how they're responding in the times of COVID, and a little bit about the resources and the services that they provide to the community. So, Deidre, I'd like you to introduce yourself and tell me a little bit about the Center for African American Health and the services you provide.
Thank you so much for inviting me here today. I'm excited to tell our story and to meet you. So again, my name is Deidre Johnson, and I'm the CEO and Executive Director for the Center for African American Health. We have actually been serving the community in Northeast Denver since 1997. We started out as the Denver Black Church Initiative, and then in 2005 became the Center for African American Health. And really for 10 years, we're focused on health education and health promotion for seniors. And I'm proud to say that in the past 4.5 years, we've expanded. So not just serving seniors, but seniors as well as the entire lifespan. So we've added parenting programs. We've done some things with youth and really kind of working with families in general. We also focus on not just health, but the social determinants of health. And in 2018, we became a family resource center. And so having that be an association we could join with tools and a business model that we could adapt to meet the growing needs of our community was a perfect match. And we moved into our own new building. So we're in the middle of a capital campaign in this pandemic. But we went from 8,000 square feet on Clayton campus to 21,000 square feet. And we have what was formerly a school that we eventually want to convert, but that's really where we're growing what we hope to be a one-stop, so that no matter what you need, you can come to us, and it may be something we can do, but in the very least, we can help navigate you to where you need to be and to the services that you need.
That's great. One of the things we did when COVID first hit was we sent out a survey to all of our grantees just to kind of get some information on how they were dealing with the crisis. And one of the responses we received from you was that you just saw a huge demand and an increased demand in services. I was wondering, maybe you could speak to what you've seen over the last 6 or 7 months and how you guys have had to respond.
Definitely. The first thing we saw was a huge increase in people who are food insecure, which makes sense if you've lost your job and then suddenly you need assistance with that. A lot of people losing jobs as well. And so we paused a lot of our traditional in-person programming and were able to take it virtual. But we also started doing a lot of new things that a year ago I would never have predicted that we'd even do. So in the month of May, we were able to give out $82,000 to families just in direct financial assistance to cover rent, prescriptions, food, utilities, just those emergency needs. And someone in the community was telling me that nobody else was doing this. And when I dug into it, what I realized is there are places you can go for this type of assistance, but the system needs you to be on the verge of eviction, on the verge of, your life exploding versus this has happened. How can we prevent anything more happening and give you time to think and figure out next steps? Because we had our new building, we were also able to work with the city to do a lot of distribution of personal protection equipment. So we started out with masks, cleaning supplies, toilet paper, paper towels, and we would get those from the city, and then we would disperse it out to food banks and shelters and the like. And then it just started getting in the habit. And we've started a safe sanctuary program for churches that if they choose to start meeting in person again, they can come by and get the equipment they need to stay as safe as possible. We've helped some child care centers with the laser thermometers and other supplies they may need to stay safe. And so that's really now become a new part of our day-to-day. Mm-hmm. And really continuing to beef up and bolster our navigation, like who are those partners we can work with for different things, because so much of what we are able to accomplish is in partnership with other agencies.
Well, and it's so important to be well connected with other resources because your clients, the people you're serving, they have a relationship with you. and to expect them to go out to 20 different resources to get what they need is just impossible. So to see that, you're able to make those connections, I think that's a great resource for folks, especially during this time. You and the Center for African American Health have been talking about, the experiences that COVID has had specifically on the Black community. What are some of the healthcare specific issues that your community is facing?
All COVID did was shine a light on long persistent health disparities that have always been there.
Right.
So in a way, nothing new happened, but because the light has been shined on this and because we have been taking such a huge toll, I'm encouraged by folks galvanizing to say, we need to do something about this. Because if we do nothing, we'll be right back in the same place when the next pandemic comes along. Given the systemic racism that our country is kind of built on, we're really seeing the fruits of what the system has been designed to produce. And so at the same time we offer programs, we realize we can't program our way out of it. And we've always been kind of dabbled and partnered in advocacy. How can we change some policies, both locally and at the state, to ensure that things improve? And so kind of that parallel effort is really going to be our goal going forward.
Well, it's great. And I think, it's encouraging to see more of our nonprofits step up in an advocacy role. I think, sometimes myself, just with my experience in the nonprofit sector, we tend to think that we're limited in what we can do in that capacity. But I do think that we actually have more ability to really be a strong voice for some of that systemic change. And we need it, I think, so desperately now. In terms of oral health practice, have you seen any changes in the way you've delivered services or you've been able to do outreach in your community?
We had planned in our new building to partner with some dental students to do some screenings. And so we've had to kind of put a pause on that. And then depending on what happens with COVID, we've always been very committed to making sure we can use our building as a place where whatever the screening is, we have a kind of a typical schedule. We've always had at our health fairs a dental presence and an oral health presence. And when I was in philanthropy, and I still love the model of the cavity free at 3.
Yeah.
Because even my mom's a nurse, and even that generation, we grew up, you don't have to go to the dentist until you're 3. Well, we know so many of those things we took for granted aren't true. And so how can you start, even in pregnancy, making sure that oral health is a priority?
I think it's such good work that you guys are doing. And we know from data the connections with some of the things you're talking about when it comes to diabetes or, heart health, and making sure that, there's a connection that exists between oral health and those other diseases. And so what can we do, again, to take a whole approach, a whole person approach, and make sure that people fully understand the science and what they can do to have good preventative oral health care. Well, I think it's great, the work that you're doing, and I really appreciate you taking some time to talk with us today. Is there anything else you'd like to let our audience know, or our Delta Dental of Colorado teammates know about your organization?
I'm really proud of the work we've been able to do. But again, we couldn't do it without the support from your organization, others, as well as just people in community. And someone asked me one day, especially we were talking about health equity. She was a white woman working in this space, and she's like, sometimes I don't know what to tell people who just in her mind don't get it. And I told her, but you don't think of it that way because you're really the best messenger. We're all the best messengers to talk to the folks in our circle of influence. And inviting me to this meeting, if folks have particular biases, isn't going to make them hear anything. They need you to lean in and kind of be that messenger to kind of begin to see people, because if you can't help people you can't see.
I think that's true. And I think, so much of, I feel like the problems we have as a nation and as a society is due to ignorance and a lack of understanding of what it's like to walk in somebody else's shoes and what different parts of our society are facing. And so I think that's really good advice. And I think that, we all have a part to do when it comes to being a voice, especially for those who are really struggling during this time. So thank you for your work on this, Deidre, and for all of the amazing things that the Center for African American Health is doing for our communities. And I thank you for being our Smile Power Hero of the Week and taking some time with me today.
Oh, thank you so much.
All right. Have a good day.